Hello, Ryan.
Hi, how are you doing?
I'm doing great. How about you?
I'm doing good. Just
Okay.
have, but
Okay.
yeah, I
Uh,
think
Let me ask a question first. You will
yeah,
study antibiotics, right?
yeah,
And fluid balance and autonomic nervous system.
yeah.
Yeah.
I don't know why for some reason I'm stuck on the automatic nervous system. I feel like it's probably easy, but I was really sick during lecture,
Mhm.
uh, and I just don't have it memorized. So
We will
um,
make it easier, don't worry.
yeah, she said something about making a chart and listing like the implications and interventions. Um,
Yes.
okay.
We have three or four types of drug in autonomic nervous system. Okay.
Okay.
And in antibiotics, it's the most easiest one of them. It just talks about four or five types of antibiotics.
Okay.
And we will end with fluid because it's the most, it's not the toughest one, but it has lots of knowledge or lots of informations. So
Okay.
we can take it on Sunday. Okay.
Okay. That's fine with me. Oh, and just FYI, I can't see your screen in case like,
Yes, I will share it now, right now.
oh, no worries. I'm assuming Wafa sent you all of our PowerPoints.
Yeah, they sent
Okay.
me some points and also some study guides. Okay.
Oh,
Abir has sent me some and we
oh,
can use it.
oh, perfect. Yeah, I didn't know they did all that.
How was your last exam?
I didn't do the best.
Mm.
But I think I'll do good for this one, because I have enough time to study.
Yeah,
Uh,
I just want you to, we can start before the exam, 4 days just before the exam, you will solve well. But
okay.
studying before the exam just and doing the exam is very hard to remember all the information.
Right. Yeah, I've never done that before, so I didn't do as good, but I'm not mad at myself if that makes sense. I just have to do good for the rest.
Okay,
Oh, excuse me.
let me share.
Yeah.
Yes, it is.
And hopefully the sample exam helped you because
Yeah, it helped me. I have understand how the exam it will come.
okay.
Okay. It was the previous exam about pharmacokinetics and etc.
Yep.
Okay. Our lecture, it will talk about autonomic nervous system. Okay.
Okay.
But before getting into this, we just need to draw our brain and spinal cord. Okay.
Okay.
This is our brain and the spinal cord. We have three types of nerves that get out from our spinal cord. The first one is named somatic nervous system.
Okay.
And this is not our talk. The somatic nervous system enables us to move, to speak, okay?
Okay.
Like if you want to pick something, you're using your somatic system. And the other two is named autonomic nervous system. They are involuntary. You can't master them, okay?
Okay.
They get affected by your physical health or the environment around you. Like the first one is sympathetic system, and the second one is parasympathetic. Okay.
Okay.
What is the difference between them? Do you know?
Um, yeah, I think the sympathetic is the fight or flight
Yeah, that's right.
one,
Right.
and that the parasympathetic is the rest and digest
Yeah,
portion.
that's right.
Um,
This is rest and digest.
yeah.
Okay. Now you have something important. You have an exam, okay? So you will be so stressed. So what system will work in that case?
The sympathetic.
Sympathetic system.
Yep.
That's right. So
Working
it's
perfectly.
gonna affect your, the first thing is gonna affect it's your eye, right?
Yeah.
You wanna see well or see a blurry vision? See well because it's a very difficult situation and you have to memorize everything. So you should steer very well into your notes, right? So there will be mydriasis.
Okay.
It means what? It means pupil here is dilated. The pupil. Dilation, okay?
Okay.
So what is the effect of sympathetic system on your eye? It will make it dilated.
Okay.
So again, it's going to affect your heart. It will do what?
Raise your heart rate,
Yeah,
tachycardia.
tachycardia. That's great. Increase your tachycardia. It also affects our blood vessels. So it's going to make what? It's
They're
going,
going to constrict, I
yeah,
think.
constrict our vessels because we need to direct our blood supply into the most vital organs, like our brain, our muscles. If you are fighting or something, you need to run, okay, quickly. So you need lots of blood to get into your muscles. So it's gonna make vasoconstriction to elevate our blood pressure. Vasoconstriction. Okay,
Okay.
constriction. So it's going to affect also. So the effect of it, it will be what? Elevate our
Um,
blood pressure, right?
yep.
Okay. Also, it will affect our digestive system. I think it's not the time to digest food or something. The situation is harder than that. So it will affect and delay our uh, digestion. So it will make what in our digestive system? Hmm, do you think?
Um, yeah, it's gonna lower our
Uh, yeah,
digestion.
it's gonna decrease our bowel movement.
Oh, okay.
Bowel movement. So you're gonna suffer from maybe constipation. Okay, because it's not the time to go to bathroom. It's not that time. We fight or we do something which is tough, so we need to focus on our brain, our muscles, our blood vessels, so our GIT system is gonna be relaxed, so there is no digestion. Okay.
Okay.
Okay, and lastly, it's gonna work on our urinary bladder. I think it's not the time to pee too, right?
No.
Yeah, if you're fighting or doing something difficult, so you're not going to think of peeing or going to bathroom. So it will relaxate our urinary muscles, right?
Okay. That
So
makes sense.
it's gonna make what? Urinary
Uh,
retention,
okay.
retention. So this is the effect of our sympathetic system on our body, starting from eyes to urinary bladder. There's another one, very important one. It's our lungs. It's gonna do what in our lungs?
And won't they expand, I think?
Uh,
Bronchia.
y- let me tell you something. You're fighting, okay, or you're getting through something very stressful. So you need more air, right?
Mm-hmm.
So it's because you need more air, it will expand your bronchus. So it's named bronchodilation.
Dilation.
That's fantastic. Okay,
Okay.
that's a great. So here is it, our sympathetic nervous system. It works on our pupil and until our or getting into our urinary system. Okay,
Okay.
that's a great. I need to add something here. We have center here, right? This is the
Yeah.
center. All the information comes from here. So this is efferent, and efferent is going to our cells in different sites. Like this cell may be in our heart or blood vessels or digestive system, etc. So this is our sympathetic nerve. Okay. To get in touch with these cells, it will secrete something here. It's called neurotransmitter, right?
Yeah.
This neurotransmitter it is the message that this nerve will secrete it to work on receptors here on our cells to make the change. Okay, so it secretes what here? It secretes adrenaline. Okay,
Okay.
adrenaline is a neurotransmitter secreted by sympathetic nerves to work on receptors on cells. Okay.
Okay.
Okay. So what if I asked you a question? What is the main hormone or neurotransmitter that affect all these tissues and makes this difference. It's adrenaline.
Adrenaline. Okay.
Yeah, adrenaline. So this adrenaline work on these cells on something named receptors. You got it?
Yep.
Okay, we have three types of receptors. The first one is named beta 1.
Okay.
We just have one heart, so beta 1 located in our heart. Okay,
Oh,
so the other one is named beta 2. It located where we have two lungs, so it's found in our lungs.
okay.
And alpha, it located in our blood vessels and our eyes. So in our eyes, it makes the difference. It make here dilation, and here it make constriction. Okay,
Okay.
that's very great. So if I gave the patient adrenaline from outside, it's named what? It's named sympathomimetics. Okay,
Okay.
because it mimics the adrenaline that found in our blood. Okay, so they have the same structure and work by the same mechanism. So it's sympathomimetics. Okay,
Okay.
adrenaline has another name called epinephrine. So epinephrine and adrenaline are the same structures. They have the
Okay.
same structure. You got it?
Yeah, I do.
That's great. So our brain or our blood or our body system got affected by those two things, sympathetic and parasympathetic. So let's get into our parasympathetic and then read our study guide, okay?
Okay.
We'll make it easier to hear. Just we need to delete those because it's gonna affect the same organs.
Okay.
Now your parasympathetic system works while you're resting. You're eating popcorn and watching a movie, okay?
Mm-hmm.
And everything is okay. You're very relaxed, and there is no fight or flight. There is no exams. So your parasympathetic having the upper hand right now. So your parasympathetic, what it will in our eyes, it make it very constricted because we don't need to focus on anything. So it will make eyes, here, pupil, constriction. It's like pinpoint. Okay.
Okay.
It's called pinpoint action or pinpoint effect. So this is constriction.
Okay.
We're talking about what, Ryan? Parasympathetic, okay?
Yeah.
Yeah.
Yeah, rest and digest.
Parasympathetic. Yeah, it's rest and digest. So it will
Mhm.
affect our heart. It will make what?
I think it'll slow the heart rate down,
Yeah.
right?
Yes,
Card.
bradycardia. We're watching a movie and everything is very relaxed. So yeah, we don't need our heart to pump fast because we are relaxed, okay?
Okay.
But if you are if you're watching a very scary movie and you have find a very dangerous scene, you may your sympathetic may act and make tachycardia, okay?
Okay.
Okay. The second thing it will affect it are lungs. It will make what?
Uh,
Do we need more oxygen to our lungs?
no.
No,
I,
we're relaxed and we can breathe just quietly and slowly. So it will make vaso, not vaso, broncho. Yeah.
okay.
What?
Is
Constriction.
yeah, bronchoconstriction. Okay.
Yeah. We don't need more air to get into our uh, respiratory system. Then our digestive system. It's named rest and digest. So it's going to increase our bowel movement, right?
Yep.
It will make you go to the bathroom. So if you're having parasympathetic overactivity, it may cause what? Diarrhea.
Okay.
Why? Because you're having bowel movement, very rapid bowel movement. It will push or will make you having diarrhea. Okay.
Okay.
Okay. So on our urinary system, it will make what? We can go to bathroom. It's okay. We are resting. So it will constrict our urinary bladder. Okay.
Okay.
Okay. So if your urinary bladder constricting, so you will go to what? Bathroom. Okay.
Okay.
So the question now, if you're having parasympathetic overactivity, you will suffer from what in your urinary system?
Like incontinent peeing a lot.
Yeah, yeah, urinary incontinence. That's right.
Okay.
Okay, let's get into here again. So any nerve, as we know, should contact with the cell by secreting neurotransmitter. What is the name of neurotransmitter that parasympathetic nerve uses to transmit the signals or transmit the message? It's named acetylcholine.
Okay.
Choline, okay? It's very important. Why? Because if I need to give someone parasympathetic drug, it will named what?
Here.
Parasympathomimetics, right?
Yeah.
Okay, it have another name which is cholinergic. From where we got the word cholinergic? From this acetylcholine. So it's cholinergic drugs. Okay,
Okay.
you got it?
Yeah. I was just writing it down, but I'm just actually gonna just watch and listen to you.
Okay, so if I give a patient a drug from outside, and this drug is sympathomimetics, so we can call it adrenergic drug.
Okay.
Why? Because the substance or the neurotransmitters in parasympathetic, in sympathetic, it's adrenaline. So we add energy. So we add energy. So it's adrenergic drugs. If I give a patient parasympatholetics, it is a drug that will break these acetylcholines and it will block this action. It will named anticholinergic. Okay.
Okay, that kind of makes sense how you
Yeah.
explain.
So in our lecture, we're going to study just three drugs. The first one is adrenergic drugs. It's related to our sympathetic system, so it will act as our sympathetic system. And the second one is gonna be cholinergic drugs. It will work as our parasympathetic system, so it will increase our parasympathetic system. And the third class is gonna be anticholinergic drugs. It will block the action of acetylcholine, also blocks the action of parasympathetic system. So it's kind of related or kind of similar to sympathetic drugs. Okay,
Okay.
this is all our information here. So if the patient have here, let me okay, let's get into our study guide. So this is the first thing, sympathetic system. It's fight or flight, and parasympathetic system, rest and digest. Okay.
Okay.
It works on what? It works on those kind of nerves, works on our heart rate. So they make regulation. There is homeostasis between both of them. This works and this works. So there's a regulation. If the upper hand of one of them, it will affect our body. It will cause diseases.
Okay.
Okay. And secretory glands like stomach, sweat glands, bronchial, and the smooth muscles. It make what in our smooth muscles, like digestive, as we said, sympathetic will decrease the bowel movement, but parasympathetic will increase. Okay.
Okay.
So what is the homeostasis, Ryan? It's the
What
balance.
the balance? Yeah.
It's the balance, yeah, between those both systems to get the optimal function.
Okay.
Okay. Okay. Here is we have sympathetic system or adrenergic agent. We said it's adrenergic because our neurotransmitter is adrenaline.
Okay.
It's our magical drug. So adrenergic drugs or agents, it stimulates the fight and flight response. So if I give a patient adrenaline from outside, it will make what in our eyes?
They will dilate, right?
Yeah, so it's midriasis.
Okay.
And on our hearts,
That will it'll increase heart rate.
yeah, increase heart rate. So if a patient suffer from cardiac arrest, So the best option to give is what?
We would want to give them the sorry, what was it called? Cholinergic?
No,
Oh,
just let me clarify that. Cardiac arrest means you have severe bradycardia, okay?
okay.
So you need a drug to increase your heart rate, right?
Um,
Yeah,
yeah.
you need a
Yeah, yeah, yeah.
sympathetic.
Oh, that makes sense. Yeah, yeah, yeah. That makes sense.
Yeah,
Okay.
you need a sympathetic effect to increase your heart rate. So you're gonna give him adrenaline.
Got it.
So the first treatment we use adrenaline for, it's cardiac arrest. Okay.
Okay.
Okay. Now it affects in our lungs. It make what? To make it very bronchodilated, right?
Yep.
So if someone has anaphylaxis or severe bronchial spasm, you're going to give him what?
The adrenaline.
Yeah,
Nerd.
adrenaline. The same medication. So we need adrenaline in our medicine in two cases. The first one to treat cardiac arrest, it's gonna work on what? Beta 1 receptors. The second thing to resolve our bronchial spasm, our severe allergy, our anaphylaxis. So it's gonna work on beta 2. Okay.
Okay.
So that's it. You just have to memorize those two things. Our adrenaline treats cardiac arrest and allergy or severe anaphylaxis. Okay.
Okay. Okay.
Here is it, beta 1. It works on one heart, so it's found in our heart. Beta 2 in respiratory, at two lungs, so it will make our bronchial to dilate more. Alpha found on our arteries, so it will make it very constricted, and also it's found on our pupils. It will make it very dilated.
Okay.
So here is they are sympathomimetic drugs. So what does this mean? It means we give drugs that mimic the action of sympathetic nervous system. Okay?
Okay.
Okay. Here is it. If you stimulated beta 1 in our heart, it will increase the heart rate. Okay, we said it.
Yep.
If you stimulate beta 2, it will make our bronchi to get expanded. So it's gonna treat any case that related to bronchospasm.
Okay.
We said the same. Okay. So if someone, let me ask you this question, or you just have a discussion with you about this. If someone is stressed or having an anxiety for more than 1 year, what do you expect this patient to have as a disease?
Um,
Let me add something. He has an anxiety, right?
yeah.
So his sympathetic system all the time is overactive, right?
Yep.
So it's gonna make what? It's gonna always make vasoconstriction all the time. So this vasoconstriction is gonna elevate our blood pressure. So after a long time of an anxiety and stress, he may get hypertension, right?
Okay.
So I think it makes sense, right?
Yeah, no, that makes sense.
Yes. Okay. So here is a peripheral. It will make vasoconstriction, and with time, it will make us, or it will make the patient have hypertension or elevated blood pressure. So here is it. We have just three, or it's just two names of drugs. The first one is epinephrine. Okay,
Hmm.
you hear me? Or
Yeah, no, I hear you.
or adrenaline. So they have the same meaning. So they're gonna treat what? Cardiac arrest and
And
anaphylaxis. Okay.
oh,
Yeah, that's it. So you know that if any patient have anaphylaxis, which means a severe allergic reaction, they may die because they have a severe bronchoconstriction. If you give them intramuscular adrenaline, you're going to save them life.
okay.
Okay,
That
so
makes
it's a life saving.
okay.
Okay, so what is this albuterol? It's what? It's beta 2 agonist. It means what? It increase the effect of adrenaline on beta 2. So it will treat asthma. If we have a patient have asthma, it will stimulate beta 2 and cause bronchodilation. Okay.
Okay.
The other drug we have, it's named Sudafed. Sudafed is what? It's pseudoepinephrine. What is the meaning of pseudoepinephrine? It's a chemical component that mimic the action of adrenaline. So we use it for what? We have our nose, okay?
Yeah, so yeah, I kind of get that.
This is our nose. We have blood vessels here. We have a common cold or anything that like allergic rhinitis, for example, okay? And our blood vessels here dilated. So it's going to lose plasma, which will spill from our nose as a drops or water, okay? So
Okay.
we want what? Want to constrict these vessels. So we give them something like adrenaline to constrict these vessels and prevent this sneezing. So it will cause what? It will cause, here is it. We'll have, where is it? Yeah, nasal decongestant.
Okay.
Okay, it will treat our congestion here because it will cause what? It will cause vasoconstriction. Okay.
Okay.
Okay, there's an important question here. Here may came into your exam. If I give a patient Sudafed, okay, it will work in what? What receptor found here?
That would be beta two.
No, it's vessels, so it will be
Wait,
alpha.
alpha, that's right. Yep. Okay.
Yeah, but this drug, pseudoephedrine or pseudoephedrine, it's non-specific. It's not going to select just alpha. It will affect also beta 1. So it will make tachycardia, right?
Yep.
So if a patient taking Sudafed, they may experience tachycardia as a side effect.
Okay.
You got it?
Yeah, that makes sense.
Yeah, because these drugs not selective. These drugs is not going to just select one receptor to work on. It's gonna working on alpha and beta 1 and beta 2 as well. But the most important effect, the patient will suffer from tachycardia because it's adrenergic drug. It increase the efficacy or the affinity of adrenaline to these receptors. Okay.
Okay. Okay. I'm
Yeah.
following.
Here is a test question hint. People taking Sudafed may feel what? What is the name of this? Jittery and palpitation. You know the meaning of palpitation?
Yeah, like your heart is
You're hearing heart rate
yeah.
or heartbeats. Yeah, that's a cause of because of as a side effects. So if I asked you now, what is the side effects of our sympathetic drugs? It will affect all the system, right?
Yes.
It will make it fight or flight. So the patient will be nervous if they're taking sympathetic drug. Insomnia, they have insomnia, they will not be able to sleep. And also there's fine muscle tremors. Okay.
Okay.
And palpitation. Why? Because these drugs working on beta 1, beta 2, and alpha, and tachycardia and hypertension. Okay. So palpitation related to what, Ryan?
Um,
What receptor?
the alpha.
No,
Oh my gosh, I keep on getting it wrong. Sorry. I'm like taking notes. I need to just listen. Palpitation would
it's in
be
our
heart
heart, so it's
beta
going
one.
to affect beta 1. Yeah, great. So, and tachycardia?
Alpha.
No, it's beta 1
No,
too.
I keep on getting it wrong. Oh my gosh, beta ones.
Yeah, so about
That's
hypertension,
related to the heart. Yep. Okay.
yeah,
Hypertension would be
alpha, because it's our
yeah, alpha.
vessel.
Yep.
Yeah. So, and nervousness and insomnia, it has a direct effect on our brain itself. Okay.
Okay.
Okay. So, having too much of caffeine, so we'll have shaky hands and trouble sleeping. They have the same effect. Okay.
Okay.
So that's it. We just finished our first thing, which is sympathetic nervous system. Okay.
Okay.
What you need to know for your exam is that epinephrine or adrenaline, it treats the most important life-threatening conditions, cardiac arrest, and anaphylaxis.
Okay.
Type if I asked you what is the drug you use for bronchial asthma, it's albuterol.
Albuterol. Okay.
Yeah, what is it? It's beta 2 agonist. It stimulates beta 2 in our lungs. So it makes us having bronchodilation. Okay.
Okay.
What about Sudafed? It's a pseudoephedrine. It's a nasal decongestant. Okay. It works on alpha and beta. It's not selective. So the patient is gonna suffer from tachycardia as a side effect of this drug.
Okay.
Okay. Yeah, that's it.
No, that makes sense. Okay. Thank you for explaining that. I
You're
will.
welcome, Ryan. If you're having any question, just ask me, okay? Don't hesitate to do this.
Okay. I will.
Yeah, because I need you to get high grades. So that's our mission.
Right. Yeah.
Okay.
This I'll be able to study. I just need to make a chart, write it down, and then just memorize it. I'll be fine.
Okay, that's okay. So now for nursing consideration, it's okay to be cautious, okay? You need to monitor heart rate and blood pressure every time. And if the patient have hypotensive or bradycardia, you should give him what? Epinephrine, okay?
Okay.
Let's get into our parasympathetic system. Why we call it cholinergic, Ryan?
Because it acts
Yeah.
as
Our
mimics.
yeah, our neurotransmitter is what? It's acetylcholine. Okay.
Okay.
This is our chemical that activate our parasympathetic system. As epinephrine activates sympathetic, acetylcholine activates what? Activates parasympathetic. So we said the drugs that increase acetylcholine, cholinergic, and that block acetylcholine, anticholinergic. Okay?
Okay.
Okay. So the drug that mimics the parasympathetic system and enhances relaxation and digestion names what? Cholinergic drugs. So it
Okay.
increases the effect of our parasympathetic system. Okay, it's named also, as I told you previously, parasympathomimetics because it mimic the action of parasympathetic system. Okay,
Okay.
and here is our target organs. As we said, heart rate, it's gonna decrease our rate, so it will cause bradycardia. Okay,
Okay.
okay. What about colon? It will cause peristalsis. You know what peristalsis?
And that will sorry, give me one moment. I can't think of it right now.
Okay,
Paris.
peristalsis means the bowel movement.
Oh, okay.
Yeah, so it's going to increase our peristalsis, and this will increase our digestion.
Okay.
Okay, if you're having a very good peristalsis, it means your food is digested very well. So this is the effect of parasympathetic on our colon. And bladder, it's going to increase what? Increase bladder tone. It will increase our bladder constriction. So it will make you to pee, able to pee, okay?
Okay.
And ocular, it will make pupil constriction. What is caused? We said it pinpoint effect. Okay.
Okay.
And also, parasympathetic decreases our intraocular pressure, which means the pressure in our eyes. It decreases it. So if a patient suffer from glaucoma, it's a very dangerous disease. It means elevated intraocular pressure. We give him sympathomimetics. We give him cholinergic agents. It's going to decrease the intraocular pressure. Okay.
Okay.
Okay. Before getting into down, we just need to, I just need to give you three example here. If someone suffer from constipation, okay,
Yep.
just think with me. That means what? It means their parasympathetic system is not effective, right?
Yeah.
It's not working well. Okay, so we will give him what? Give him parasympathetic from outside. So we'll give him cholinergic agent. Okay.
That makes sense. Okay.
Yeah, to overcome this constipation, to increase our peristalsis and increase our digestion. So the first thing to use is from parasympathomimetics to treat constipation. Its name what? Its name Reglan. Here is it.
Oh
It's
yeah.
me. Yeah,
Yeah.
Reglan, metoclopramide. Okay.
Okay.
Okay. If someone has a defect in their parasympathetic system, will they be able to go to bathroom?
No.
No. So they will be having urinary
Retention. Yeah.
retention. So we want to give him what? Cholinergic agent. It's what? It's urocholine. It's a cholinergic agent. It's a parasympathomimetics. It will increase our parasympathetic action. So it will make our bladder constrict and we can go to bathroom. Okay.
Okay.
So these are uses here uh, from cholinergic drugs. We use it for three diseases. It's constipation, urinary retention, and glaucoma. That's okay?
Yep, I'm following.
Yeah. So these drugs increase what? Increase our acetylcholine in these organs. So here is it. Reglan or metoclopramide used post-surgery to stimulate bowel movement. So treating constipation. The other one, what? Uricholin. It treats, it's named pithinicol. It treats what? Urinary retention. It
Okay.
makes sense?
Yeah, I'm
Yeah.
following.
Uh, Pilocarpine. What is pilocarpine? It's cholinergic drug that decreases the intraocular pressure. So it treats what disease? Treats glaucoma. Okay?
Yep.
So if I give someone too much parasympathomimetics of these drugs, what do you think they're gonna suffer from as a side effects?
Diarrhea.
Yeah, that's great. Here is it. Diarrhea. We should type it here. Diarrhea. Okay. What about the heart?
It's going to increase the heart rate.
No.
Oh, wait, sorry. I keep on getting, I need to start paying attention, not write notes. Um,
They
so,
will suffer from bradycardia because it's a parasympathetic effect.
okay.
Okay, it's too much of parasympathetic. Side effects means having too much of something. So you're giving the patient parasympathetic drug, so it's going to increase the good things to bad things.
Okay. Then,
Okay, so what about bladder? If they have a
uh,
side effect, it will be what?
they're going to like pee a lot. So,
Yeah, incontinent.
yep, incontinent.
Continent. Okay, what about ocular? It's not, it doesn't have any side effect. So there is another side effect here. Its parasympathetic effect increases our what? Increases our vascular diameter. So the patient may suffer from sweating. Okay,
Oh, sweat.
vasodilation because it causes vasodilation in our vessels.
I'm gonna write that down.
Okay, here is it. Diarrhea, frequent urination. Why it causes blurred vision? Do you know why?
Yeah, didn't you just say
Yeah,
vasoconstriction?
it makes not vaso, but pupil constriction.
Oh,
And
cool.
this pupil constriction will not able me to see the far things. So it will be very difficult to me to see the far things. So it will cause blurry vision and excessive sweating. Why it causes excessive sweating? If you're having vasodilation. So all the plasma will get into our skin because we have pores in our vessels. So it's if it's got dilated, it will escape, plasma will escape on our skin, so it will cause sweating. Okay.
Okay.
So those are side effects of our parasympathetic system. So we just have a 1 minute for ending our meeting. So can we start after 10 minutes as a rest?
Yeah, that's fine. Yeah.
Okay. See you after 10 minutes. Okay.
Okay. Thank you.
Okay, Ryan. Welcome.
Bye.